Now I got a guest who's an expert on this healthcare business, Dr. Bob Moffit. He is the author of a book called No Choices, No Exit, The Left's Plan for Your Healthcare. And he is a senior fellow at the Heritage Foundation, joins us now from Maryland. So am I overstating, doctor? Am I making any mistakes?
I don't think so, and I'll tell you why.
Now I got a guest who's an expert on this healthcare business, Dr. Bob Moffit. He is the author of a book called No Choices, No Exit, The Left's Plan for Your Healthcare. And he is a senior fellow at the Heritage Foundation, joins us now from Maryland. So am I overstating, doctor? Am I making any mistakes?
I don't think so, and I'll tell you why. Last time that they came out with this idea, the cost was $400 billion. The current tax proposals that they're coming up with right now don't come close to that. It's about $160 to $170 billion. So they're making an enormous promise. They're going to take over one of the most complex sectors of the American economy, and they're going to have the Bernie Sanders bill basically does the same thing, effectively at the national level. It says, in effect, yeah, you can have a private relationship with the doctor, but only if the doctor agrees to give up all reimbursement from the government and drop out of the program for 2 or 3 years or something like that. They're doing the same thing here. They're denying any kind of independent relationship with a physician.
But isn't this is the road to socialism? This is what this is. Once you go in and start to take people's private property by levying a tax on the value of their home or their stock and bond portfolio, even though you haven't sold it, because when you sell your stocks and your bonds, you have to pay a capital gains tax, okay? They already got you there, but they want unrealized stocks and bonds. They want to tax you on what you're holding. The same thing with your house. And that's socialism. They're coming in to take private property. So my question is, this would be challenged in a court as unconstitutional.
Oh, yeah.
Would that challenge hold?
Well, I'm not a lawyer, but the fact is that they're talking about expanding a level of government control over personal life that we have never seen before. And even at the state level, where the states do have a lot of authority, no question about it. It looks to me that if, in fact, you violate a person's right to have an independent relationship with a doctor, if you're talking about discriminatory tax policy, then I think you've got some kind of a legal case. It would, again, I'm not a lawyer. I don't want to judge, a legal question, but this is.
Well, it would definitely be challenged to the U.S. Supreme Court, not the Supreme Court of California. Final question is that, as I pointed out, most Californians, you said, well, people will pay more. Well, they'll pay more if they're high wage earners, but if they're not earning anything, and remember, a lot of undocumented people work off the books in the California agricultural industry and homes and things like that. So if they don't have any income, they're getting free medical care, and they're not going to pay more. They're going to get it free. And that's why...
Well, they're getting it now.
Yeah, that's why
they're
this
getting free
stuff...
medical care now.
That's why there isn't this giant uprising in California, because most people calculate, well, this is good for me. I don't care about the people who have earned things. Too bad. And that's really the bottom line, isn't it?
Well, what it is, it's creating a class system where basically the middle class will be crushed by increasing levels of taxation. And on top of that, the control over their exercise of their personal freedom, including their freedom to access the kind of healthcare that they want. But you're seeing basically a situation where you have basically a war on the middle class. And that's why
that's what Karl Marx wanted. Karl Marx in his manifesto wanted to divide populations by race. And he said that's the quickest way to communism, and it is. Hey, doctor, thanks very much for your expertise. Really appreciate you taking the time today.
Great to see you, Bill.